All right. So far, you know that all your TB drugs are
liver toxic.
liver toxics. What do you need to do?
Check their LFTs.
Check their LFTs, which would be your
AST,
ALT, and bilirubin. Very good. Tell the patient to report jaundice. And what are things that they cannot do if they're on liver toxic drugs?
Drink alcohol. Take acetaminophen.
No acetaminophen.
Aspirin, NSAIDs. Right?
Aspirin's okay because it's kidney toxic, right?
Okay, yeah. Statins.
Statins and antifungals. So you got to go back and remember your liver toxic list. Okay. All right. So each of these I did a keyword for. Okay. So if there's an underlined something, that's going to help you with your keywords. Okay.
Oh, okay.
All right. So first, Rifampin turns everything red. Okay. It turns everything red. We know it is a P450, so you have to check all the other drugs that they're on because it's an inducer and it can make all the other drugs not work correctly. Okay. So it is bactericidal. Oh, we're going back to antibiotics. Oh, God. What does bactericidal mean?
That it kills
it makes it kill its own self, like suicidal. Okay. Yeah. It's called broad spectrum antibiotic, which means we can use rifampin to treat lots of different things. That's all it means. But this is the drug of choice for TB. It's the best one. Okay. It inhibits RNA, which then RNA, remember, makes proteins, and the proteins will end up making the tuberculosis. So if it's inhibiting that, then it's going to inhibit you making more tuberculosis, or replicating it, I guess I should rather say. Okay. Turns all body fluids red, so they cannot wear contacts because they'll just see through a red hazy. You see what I mean?
Yeah.
Okay. So, and when I say all body fluids, I mean all body fluids, your sweat, your tears, your everything. So don't wear white. Okay. We already knew it was going to cause GI upset because this is liver toxic, right? You already knew it was going to cause pruritus because all our liver patients itch. All right. It can cause them to feel like flu-like symptoms. I don't know why, but this always tested on the flu-like symptoms. I don't know why. You don't do anything for it. Just highlight it. Okay. All right. We know that rifampin interacts with everything. Okay. So again, remember antibiotics, they're supposed to take them on a empty stomach, but then if they cause stomach upsets, then you take it with food. Okay. Yeah. Monitor LFTs and report jaundice. You already knew that. Check drug interactions. You already knew that. All right. Do not use with PIs or NNRTIs, or you have to increase the dose. Both of those are HIV drug classes. Okay. Which we'll talk about in a minute. So just hang on to it. Okay. So either don't use those together because it's going to make them very ineffective, or you have to bust up the dose like really, really high. Okay. And make sure that you use a backup method of birth control because it will make your oral birth control not work. And you definitely don't want to be pregnant on TB drugs with tuberculosis. Okay. No, thank you. All right. So the next one is Isoniazid, also known as INNH. Okay. Again, it is bactericidal, but it inhibits synthesis of something called mycolic acid, which is a component of the cell wall. If the bacteria no longer have a cell wall, they cannot survive, right? Yes. So they will basically just implode on themselves. With me?
With you.
Okay. So we already saw GI upset. We already saw that coming, right? Yes. And this one causes crazy blood. We kind of saw that coming too because they are
bacteria.
Liver toxic. Good. There is a black box warning on INH for no big deal, just fatal hepatitis. Damn. Okay. So we probably ought to report those, jaundice and those increased LFTs. Okay. All right. So INH causes neuropathies. Now, why would it cause neuropathies?
Liver toxic.
It's liver toxic.
And then it makes your blood
it makes vitamin B.
So all right. The liver usually makes vitamin B. It cannot make vitamin B because this drug is liver toxic. And what do your B vitamins do?
Make
healthy nerves. Okay, that's what's giving you the neuropathy. It also causes CNS side effects. CNS side effects in the neuropathy, like optic neuritis. What is optic neuritis?
Optic is your eyes. Neuritis must be your nerves. Inflammation.
So inflammation of the optic nerve. Okay. Seizures. Ataxia. What's ataxia? Drunk walk. Psych disturbances. So major CNS side effects. Okay. And then this one is I don't know. It messes up your liver. It messes up your brain. It messes up your blood. Like, could we do something better? No. Okay. Nope. All right. It is considered monotherapy for latent. What does monotherapy mean?
Just one.
You can use it by itself for latent because you don't have active, but it is a combo for active. Usually we like to do ripe as long as our livers are okay. Yeah?
Okay, got it.
This is almost always on exams, the next thing I'm about to tell you. So in order to decrease those neuropathy symptoms, we're going to have them take pyridoxine, which is vitamin B6. Okay. All right, monitor LFTs, report jaundice. Y'all, I feel like I've told you this at some point, but I don't know. With our LFTs, the ALT and the AST are usually in like somewhere between the 20s and 40s. We do not panic about those enzymes until they're usually around 5 times the normal. Okay. Because everybody's going to have a mild increase in liver enzymes for things. You take acetaminophen, you may have an increased liver enzymes. You know what I mean? You have a crazy weekend of drinking, you're going to have increased liver enzymes. So it would have to be over 5 times the normal. And then at that point, it'll be like, hey, I'm not going to ruin your liver because it causes fatal hepatitis, right?
Yeah.
Okay. So we put them on fall precautions, neurocheck, seizure precautions, level of consciousness, and what's the GCS? Glasgow Coma Scale. Why am I doing all that?
Because it causes
CNS effects. Okay, so INNH causes neuropathies and CNS effects. Good. All right. Next one is pyrazinamide, otherwise known as PPPZA. PPPZA. It is bactericidal, same thing as we've had before. We already knew GI upset was coming, yes?
Yes.
Okay. PPPZA causes polyarthralgias. What is polyarthralgias?
Oh, many joint pains.
Many joint pains. So joint pains all over, and then photosensitivity. Photosensitivity, which is
that they like light.
Photosensitivity.
I mean, they don't like to be under the sun or something.
What are they scared of it?
No.
Oh.
They just yeah.
Photosensitivity. I'm shocked. I'm quite literally
they're
shocked.
just sensitive to light.
Okay, well, what happens if they get out in the sun?
Are they like sort of breaking out?
They will burn. They will severely burn. And when you have when you're on a drug that causes photosensitivity, you go out in the sun and your skin's gonna burn like nothing. Yeah. Okay, so they should not be out in the sun. Yes.
So
yes.
Why would it be what causes photosynthesis?
There's lots of different chemical things that cause it. Yeah, in medications, it's their chemical composition.
Oh, okay.
And then it can cause hyperuricemia. What is hyperuricemia?
High amount of uric acid.
Why would they have a lot of uric acid in the blood?
Liver toxic.
It's liver toxic, and liver's supposed to get rid of that.
Yeah.
What is hyperuricemia? What disease is that?
Uric acid?
Mm-hmm.
Oh, no, eventually it'll be gout.
It'll be gout.
Yes.
Okay. All right. Treat arthralgias, polyarthralgias with NSAIDs, not acetaminophen. I guarantee you they're going to try to throw that at you on an exam. They're going to be like, oh, your patient's on PZA and they're complaining of muscle pain. What's your best therapeutic response? Take a Tylenol in order to help alleviate your symptoms because you are loved. Yeah, not that one. Okay. All right. Monitor LFTs and report jaundice. You should already know that. If you are taking PPPZA, it can precipitate gout flares if you already have gout. So if you have gout and then like, hey, start on PZA, you can't anticipate you're going to go into a massive flare. What is the drug that we give for a flare-up for gout?
Flare-up for gout?
Yep. The only one you can use for an acute gout flare-up. All the other ones are preventative. Yeah, I went over it like 100 times in that module. Colchicine. Very good. Very, very good. All right. Stay out of the sun. Wear SPF 50. Wear UV resistant clothing because this drug, PZA, causes photosensitivity. And what happens if you go in the sun?
You burn.
You burn. All right. Next one is ethambutol. Okay. Ethambutol. Your keyword is eyes. Ethambutol. Eyes. Okay, so it causes massive vision changes. GI upset, we already saw coming. All of them are going to cause GI upset because it's liver toxic, right? Mm-hmm. All right. It causes severe optic neuritis. What did we say optic neuritis was?
Inflammation
of the optic nerve, which can cause blurred vision and eventually can cause irreversible blindness. So for that reason, we do not give it to kids under 8 because they cannot tell you they can't see very well.
They're not reliable.
Yeah, they're not reliable and they wouldn't be able to know. Okay, so this is one we do not give to kids. Ethambutol can also cause hyperuricemia. Same thing we saw before. So for ethambutol, we're going to do a monthly visual fields test. What's a visual fields test? How do you test somebody's visual fields?
With like either the jargon test or...
That's testing your visual acuity.
Isn't it the finger thing?
That's testing your cardinal...
Like Perla?
No, Perla is testing your optic nerve. Okay, we'll get there eventually. Y'all did it in health assessment. Yes, I know they made you do it.
It has to be somewhere.
Where are your visual fields?
Like the up and down? That's your optic nerves, though.
Y'all are talking about extraocular movements or something. Where are your visual fields?
Oh, in the back of your eyes?
What the fuck? Okay. if I said, what kind of things right now are in your field of vision? Where's your
your
field of
peripheral?
vision? Okay, so
Your
we're looking out here.
peripheral.
So when I'm
Exactly.
testing visual, remember this one?
Yeah.
Tell me when you can see my fingers.
Fingers?
That's visual fields.
Okay.
You remember what I'm talking about?
Yeah,
You're supposed to
yes,
start
yes.
behind here and then tell them
Behind here,
when
and then,
can
yeah.
you see it. Okay, now y'all act like y'all experts. Okay. So, and then we're also going to do a colorblind test. Have y'all seen these little
Yeah.
cards that they give you and there's a hidden
Circle
number in
and
it?
a number in it.
So they do that every single month to make sure we're not losing your eyesight. And again, because it causes hyperuricemia, it can precipitate gout flares.
Okay.
All right. So for each one of these, you have a keyword. Rifampin turns everything
Red.
red. INNNH causes neuropathies and CNNS side effects.
Yeah.
PZA causes polyarthralgias and photosensitivity. Okay. And then ethambutol messes with your eyes. Very good.